me because she's someone who used to stir the pot. And this stirring the pot, I was like, whatever, I don't even understand what that means. And so we got her evaluated. And at 16, she was diagnosed with a language-based learning disability and ADHD. She had not ever received services for the dyslexia that she had. She received services immediately. She was put into a mandated support class and graduated, made the honor roll twice before she graduated, and she was the first person in her entire family to ever make the honor roll, and that happened, in her junior year. So that was pretty exciting. Ultimately decided college wasn't for her and worked in business. She was super sharp, but just not academically oriented. So it was very helpful, and I think, particularly for kids who go to independent schools where the school isn't necessarily constructed for different kinds of learners, it's very helpful to have a report because there are services and accommodations that need to be made. So my vote would be yes. Not to pathologize, but really as a method of inquiry. Seth?
Thanks so much.
You're welcome.
Yeah, thanks. Your last comment, not to pathologize, is really important too. But yeah, as a method of inquiry, yeah. So you want to be in my opinion, you probably want to be proactive. And we just had a discussion earlier today with one of the speakers about how to frame it and about telling your kid about their disability. And that I think we have it recorded or on the Facebook from earlier today, but you will probably want to watch that with Dr. Liz. But how to talk to your kid about it, and like so then this brings up the whole labels discussion, and are labels good or bad? And in 2 seconds I'm going to tell you they're both, and it depends on how you use them. But to identify it and get a diagnosis proactively in case you really need certain support, you probably want to do that. And then you can start going down the rabbit hole and learning. Beware of what you learn and from whom. And there's a lot of opinions. I remember watching something a couple years ago about them talking about how beneficial not CBD but like marijuana was for ADHD. I would never agree with something like that. The kids that I've seen that start smoking a lot of pot in high school or college, like that is not helping in any, it's harm, but so be careful and because everybody will be convincing about what they say. And I try and whatever I say, like I started off today saying, this is my opinion. Like I don't try to act like I know everything. And there are people out there who do, and they sound very convincing. Beware, but find information that you really resonate with and that is backed by evidence, and start going down the rabbit hole to see how to support your kid. But I'd probably get the evaluation personally and cover your bases and learn more about it. And there was some other thought that I had, which is not coming to me, but you really, and I like what Sharon was saying about the kiddo that started receiving services and just how helpful it was for that kiddo. But you also need to understand that there's often, not always, often a lot of resistance from the schools in terms of getting the ball rolling, getting the services you need, and you're going to have sometimes an uphill battle with that. And when your gut feels like something's not being done, don't hide away from that. Like go to them and be like, I don't feel like I'm being heard. Something doesn't feel right. We need more help. Or go to the district directly and find out what should be going on. And I put 2 links in the chat with IDEA that you can look into so that you understand your rights, not from me, but from what the government site actually says and stuff.
Yeah, and you can also, you can also hire someone who, like as a consultant, once you get the report, whether, I do this for people or there's plenty of other people who do too, and you meet with me and you say, let's go over it. What do I want to ask for? Do you want to attend the meeting? What's great about having that is that when your daughter does go to college and she has proof, quote unquote, that she does have ADHD or, a particular learning challenge, then she can register with the Office of Disabilities and qualify for, support and aid. And that's really important. And I was thinking about you, Anna-Pia, because your daughter's going to be a senior, and it is really important to check out what schools offer in terms of support, because some of them have executive functioning coaches. Some of them obviously have therapists. Some of them meet with kids. There's a group and they meet with students once a week just to help schedule and plan things. A lot of kids, when they make the transition from high school to college, struggle. Many of the college students that I work with say, I could do life and I could do school, but now I have to do both of those things. And I don't know how to do that. Like, I don't know how to manage that. And so we want to, keep a scaffolding in place to help with that transition, particularly during that first year of college, when, at least one of your classes is socializing, making friends.
I'm so glad that is actually my question, is about college. And is it better that they go to community college first?
That really depends on.
Can I interrupt
your child.
before we
Yeah.
get to that real quick? So just to show you, I'm so happy with this, but in the summit here, you can put in any word in the search. So I'm really proud of this because this is awesome stuff this year. This is new for us. But you can look up the word, for example, diagnose, and you can find every place in the summit that word was said. And then you could go to whatever, let's say this was the one you were this one resonated with you. You can go to it and literally it'll queue it up to the second that
Wow, Seth, that's really cool.
Oh gosh, this is so good.
This is so good. That is
did
so
you dive into this yet, Sharon?
Not yet, no, but that is very cool.
You can do diagnosis and it'll find diagnosis. So, and you can do ADHD. And so anyhow, just wanted to show that before we go on to the college question. But
it's a really good question. And I think it really depends on your child. Over the years that I've been a clinical psychologist, I've seen everything. I've seen kids who actually, do well in a they finish high school, they go to a 4-year college where they live on campus, and they do great. They have support if they need it. They don't have support. Maybe they have a private executive functioning coach that can work. For some people, going to a 4-year college is not quite what they're ready. They need another year for their brain to mature, and going to community college could be really helpful. I think, or taking a gap year. I think it depends on whatever narrative your child is going to attach to the choice that you make for them. Like, we want them to be able to say to people, with excitement and pride about what they're doing, rather than like, all my kids, I'm in honors classes, but I'm the only person who's going to community college.
Right. I guess my concern is like,
as if that was a bad thing, excuse me, because it's not a bad thing. And many of my clients go to community college and then transfer and do exceptionally well, because they've matured, they've learned how to manage academics, not in a high school setting. They do live at home, which kind of helps them with that life part until they've matured, they sort of are ready for more sort of connected independence.
Yeah, thank you so much for that. Yeah, I guess my concern is I could be throwing her into the wolves in college, and if they're not, what I'm noticing is, because ADHD is labeled as a disability, and if you have to go to the disability office, and kids don't want to be seen that way.
Yes,
don't want to be walking to a place that says disability office. So then there's a reluctance to wanting to go get some support. So,
right. So that goes to the issue of accepting the brain that you have. I think it's really important for us to work with our kids to accept the brains that they have, not the brains they wish they had. I have an anxious brain and a neurodivergent brain, and I've taken me a long time to accept that. And I talk about it openly, like, I had a party a few days ago for some friends who turned 60, and I was very anxious trying to get everything done before people arrived, and I was sort of activated. And one of my friends was like, breathe, bring it down. And on the one hand, I was like, F you, don't tell me what to do. And on the other hand, I was like, yes, you're right. How embarrassing. But this is out of love. I have to see this out of love. And so, yes, it's the Office of Student Disabilities, but just because you're registering with that office doesn't mean the services are there. They might be somewhere else. They might be housed somewhere else. It is a cognitive dissonance for bright kids to feel like they have to go to the Office of Disabilities. And we see this a lot with twice exceptional kids. Because nobody wants to have a disability or a disorder. I mean, no adult, no child, nobody. So we want to really talk about it as, unfortunately, this is where the services are, and we need these diagnoses and these labels to get them. We have to look beyond that to what our goal is. Like, what is the goal? The goal is succeeding in college, getting the support I need. And that's where we have to stick with. I have to tell you that I had a client who was, had ADHD and discovered they had bipolar disorder in college, and they were seeing a coach and seeing me, and there were these waves of like, I'm just not doing my work, or I am doing my work. And around February, I said, okay, what is your goal? And she said, my goal is to graduate. I said, okay, here's a big piece of paper. I want you to make a poster. What is your goal? And then she made a poster, my goal is to graduate. And she rolled it up and she took it back to her dorm. She put it above her bed on the ceiling and said, my goal is to graduate. So every day she woke up and she saw that. So we want to sort of talk about what is the goal, not, what are the sort of the obstacles.
I like that. Thank you.
And the labels. The names are good for, basically getting services, guiding mental health treatment, but they're not that helpful for a lot of other things, and they make you feel bad about yourself. So if I walk around and I say, oh, I'm such an anxious person, how am I going to feel about myself? Bad. But if I walk around and say, I'm really passionate, I'm intense, I'm exciting and excitable, I can live with that.
And I have thoughts on all that as well. So yeah, as far as the community college, like I personally failed out of 2 colleges that were not community college, ended up going back to community college, and then going back into, so I went to one in Indiana, and then went to Indiana University after getting my feet on the ground finally, and community college. And I will tell you that my experience, and a lot of kids I've worked with, their experience in community college is fantastic. Classes are smaller, teachers are more engaged, it's more relaxed, there's more support, there's less stigma, there's less craziness and crazy social problems, and exposure to really some crazy dysfunction that you find in a lot of universities. And you're surrounded by a lot more, often people are going back who are more mature. So I'm a fan, like, it's really, as Sharon said, the point is the goal. So what is the goal? And then as far as the stigma and your child navigating the stigma and their feelings about it, that's an important thing to, the labels are helpful. People have studied these labels they've dedicated their lives to studying these labels, but people can misinterpret a 1-word or 2-word or 3-word label, but they can give you really a lot to go from, and you also don't want to pathologize with it. So it's this whole complex thing, but having those discussions with your kid about it and having a healthy relationship with it is awesome, because it's like, my disability, part of my ADHD, is disabling and has been disabling. It's not a joke. Like, it's impacted my life. It impacts our lives. It's not meant to be sort of like brushed, like discounted, like the consequences are real, but also the positives are very real, and the strengths. But we have to learn how to live with our own brain and find our strengths. So while it may be difficult to digest going to the disabilities office and all that, that's okay. Hold space for that. But still, like, when I went back, and what I teach the students I work with is like, people who are successful in anything. Shaquille O'Neal, one of the worst free throw players in the NBA, but one of the best NBA players. Like, he has had the best free throw shot coaches in the world because he needed that, and like but the best people in the world have in anything, get help, ask for help. It's just, there's no stigma in it. I want to be a better guitar player. I'm not like ashamed of it. If I see someone who's great, I'm like, oh, I want to learn from you. And in college, like I started going to the writing center, all the tutorial classes, and really my frame changed. I was like, I'm paying for this, because at that time I'd failed out of the 2 colleges. I was putting myself through college and working at pet stores, and I'm like, I'm paying for this. I'm going to every writing center thing they offer, and every studies group. Anyhow, I'm gonna shut up now. But and I saw somebody else's question in the chat. So let's go to that one, if that's cool.
Sure.
Sharon, it says my
10-year-old Tui son, that one.
Yep.
And also, I think there was a question above that from Luena. Right.
Oh, great. Yeah, I'm sorry. Yeah, that one
Okay.
first.
So which do you want me to answer first?
Oh, well, the first one that came up.
Looks like
Oh,
Luena
yeah.
came first.
Yeah, where's Luena? Let's do Luena, okay. And then Andrea, if that's how you pronounce it. And then yeah. Luena?
I answered Andrea's I typed an answer to Andrea's question. So if you want to have more information, let me know. And Andrea, I'm happy to answer that as well. Okay, Luena, hi, nice to see you. What is your question?
Hi, Sharon. Hi, Seth.
Hi, Luena.
Just wanted, hi, I know you both. I followed you both over the years, and I have to say you're both my favorite professionals in this space. So thank you. I've learned so much from you both. My son is 13. He has ADHD and attentive, as well as dysgraphia. And as a result of that, he has anxiety around being at school, because being in the classroom is just so difficult for him. He's at a fantastic school which has amazing accommodations for him. He's got a lot of support. He's got great friends. In theory, everything is really good for him, but yet he still struggles. And he has become so anxious this year that he has ended up having severe tummy pain. So normally, as we would all know, if we feel a bit anxious, if we're going to sit an exam, we feel a bit sick. But his has been like ongoing for so long, and has now got so bad that he's actually missed nearly half of the year of school. He's had to stay at home because his tummy has been so sore. And obviously I've seen lots of professionals, and this question is now getting very specific, but I was wondering if you could comment on that physical side, and whether, well, particularly what I'm interested in is, once those symptoms really set in, it's very hard to deal with them and to reverse them. Do you have any experience or in people that you've seen who have such severe symptoms?
Yes. So the question where I would start, because this is a pretty serious situation, is does he have a therapist? And is he taking any medication for anxiety?
Yes, and yes. So that's the anxiety medication is the new thing this year, and that is helping a lot.
So, it would seem to me that, being able to work with someone who really is a cognitive behavioral therapist, who's an expert in that, would be very useful, because he doesn't, he actually needs tools to learn what to do when he has this physical pain, which is caused by, distorted thinking. And so while it can be very useful for him to be in therapy to talk about his feelings, I'm not saying that that won't happen. What he really needs are tools and techniques. I also think that for kids I've seen who are similar to him, that what we do is we often break down the attendance in school. You go for an hour.
We're doing that, actually.
And
yes,
then,
so I've got him back to school. So once that pain subsided, we got him back 1 hour a day to the subject of his choice. That worked really well. And then gradually we've built it up, and he's going now for about 3 hours a day. And the school's been amazing with supporting
That's
that.
fantastic. And are they providing a tutor for him at home at all?
No, that's me.
That's you.
I'm teaching him at home as well.
Because he has a health, so in the United States, because he has a health disability, that's what they would call it, a health condition, the school would be mandated to provide some services at home to complement the services that he receives at school. So I don't know what the laws are in Australia, but
No, we don't have it.
yeah, that's a bummer. Those are the things that I would really think about.
So
Also
basically shifting the mindset.
shifting the mindset, exactly. And when he goes to school, you know, what is it that he tells himself so that he can go to school? What is it that he tells himself so he can stay for 3 classes? You know, there's this imbalance between that, the worry monster, which is quite, you know, like very much of a big bodybuilder for him, and the part of him that is, you know, that is the you know, the ally, the coach. We have to work on developing that inner coach to be able to talk back to the worry monster, to have some phrases that he can say directly.
Okay.
And when he has success, to really maybe like make a wall of successes. Like every time he has a success, like put a Post-it up on a wall, like you know, way to go, or something like that. So he can start to see that there's an accumulation of them, rather than that he does something, but it sort of just like disappears into the, you know, atmosphere, and there's no tangible like reminder. Because he's not holding it in his head, because a lot of kids with ADHD have issues with working memory. So we want to make a visual of that. So, you know, my friend Brendan Mahan talks about the wall of awful, which is, you know, all the negative things we say to ourselves. And I think we need a wall of wonderful, you know, which is like what he's doing that's going well, and putting it up there.
That's a great idea. Thanks.
You're welcome.
Thanks, Sharon.
You're welcome.
Yeah, should I comment on that as well?
Sure.
So the things that went through my mind was the sleep, nutrition, and movement, in terms of how are those things in terms of being dialed in. Is there restful sleep, nourishing food, and plenty of movement? And is it a kid who's sedentary in front of computers all the time? Are they getting, a lot of times kids with hyperactivity are moving a lot. So anyhow, I would, those 3 things first of all, and then Sharon was mentioning the tools, and you're talking about the stomach. And so what came to mind is that the brain changes, the body changes, the nervous system changes. So we don't have to stay stuck in those places. The body does change. And I'm saying this from experience with a lot of kids, and experience myself. After I was in a coma a while ago, I had panic attacks for 3 years. And I never have them anymore. I get anxiety 2 or 3 times a year for about a minute, but these were daily occurrences. I did not think I was ever going to get out of this. It was terrifying. I used to have tremendous stomach problems, tremendous. And really for me, once I started getting a lot of, and I didn't know this was what it was, but executive function stuff going, that started changing a lot. But and then Sharon was talking about the thoughts, the mindset, and the wall of awful, and the wall of success. And so I talk about the body and narrative. The body is the nervous system. Like our body has responses to what we're thinking about things. So when I'm sitting here, like, so I live in Maui, we just had the fires. I noticed I had a fire when I was 17 that I caused by accident when I was a teenager. We had to live in a hotel for 3 months. My trauma was triggered the other day. We were evacuated here, and I cried the other day, but I was able to I was able to say, oh my gosh, my trauma is being triggered. Like I was able to have an experience of it where I can move through it rather than be paralyzed by it. That has taken obviously years of practice. Your kid's body, nervous system, mindsets can change with a lot of practice, and will. And what you're doing now matters and is helping. So the neurons change, the response, the stomach stuff can change. I'm not promising, everything's going to magically get better tomorrow. Obviously, it takes time. And then I want to mention 2 more things. One, To me, the experience of service with kids is tremendous when it comes to anxiety, difficult experiences, but getting them involved in service, whether it's working with animals, volunteering in the Humane Society, working with younger kids, older kids, where they're serving other people, which I think is part of the sweet spot of life, but finding things that where they love to serve and getting them highly involved in those experiences when they serve. Those are often experiences where kids are not experiencing that unsafe sense. So I want to encourage that. And then the second thing is the mindfulness. And it really is something that I have taught so many kids and myself that, and for my panic attacks, that was the number one most important thing for me, was learning actual mindfulness meditation. I'm not saying any sort of religious thing, like actual scientific mindfulness, which is something I still do today. But what that allows me to do is to not be as reactive and to be more responsive and to have a larger pause button between the stimulus and the response where I can respond differently. And I want kids, Sharon said tools, and that's what brought that up. Like service to me is the tool and mindfulness is the tool. These are tools that are difficult tools to use and take a long time to learn, but are also not rocket science. And so that's my 2 cents.
Yeah,
And I got time for 1 or 2 more questions, Sharon.
Okay, I just want to say that I think it's called like helpforanxieties.com, but Dr. Reid Wilson, R-E-I-D Wilson, he wrote a book called Stopping the Noise in Your Head. It's for adults, but he has a website, and the website has these videos, like 6 videos that are great for, you know, teens and adults. And basically there's a guy who plays a really annoying version of anxiety, and there's a woman who's trying to like live her life and learn how to talk back to it. And that might be also helpful. I'll put it in the chat. That might be also helpful. So to check out. Okay, next question. You want to let me know what that is, Seth?
See if I can find it. And I'm having trouble finding the chat properly. Okay, there we go. All right. So you said that Valerie's question, you responded to my 10-year-old to son will begin new school.
Yeah, I didn't know if Valerie had a follow-up question.
Okay. And about physical symptoms of anxiety, I think we talked about. I think
Andrea, I answered it. Did Andrea have a follow-up question?
Sorry, y'all, I'm having trouble finding what to go to.
That's fine.
Where can I find information about a school district being mandated to provide services? If somebody can put the chat for IDEA, the actual government one.
Yeah, I put that in. I put that in. That should be in the IDEA. Yes. Or each district has like a special education department, or what they call student services or pupil services. That's what they call it in my town.
And go to the district on that, especially if you're having trouble with the school itself and resistance, go to the person directly at the district, because those are usually very passionate people who are frustrated with schools that give resistance.
Exactly. Exactly.
So just don't mess around, just go straight to the top and figure out who's on your side there.
Okay, Valerie has a question. 1 second. Excuse
Bless
me.
you.
Sorry. My 10-year-old's 2E son will begin a new school in 2 weeks. That's cool. Anxiety will be high for the 2 weeks coming. How can I help him focus to have fun for the end of the vacation and to stay positive about the new school? Great question. So we know that anxiety and excitement run on the same system in our brain. It's just they're 2 sides of the same coin. So what we want to try to do is change or shift the thinking about the worrying to I'm curious about, I'm wondering about, instead of I'm worried about. This is a positive psychology reframe that's very useful. So of course you're excited about school and you're nervous. So there's a difference between nervousness and anxiety. Nervousness is when you're doing something you've never done before, you're not sure you know how to do it or you have the skill. That's natural. Then you do the thing and you're like, oh, I've done that now. It's not quite as unfamiliar. Now, starting a school is challenging. So how do we help kids become familiar in a new school? Number one, we take them to the school and we walk around the school once, maybe twice. You know, I'm sure those of you who've sent kids to high school have let your kids gone into the high school, found their locker, found their homeroom, where the other classes are, so to reduce the anxiety of that first day. The other thing is, I really want to know, what is he worried about? And then we might want to think about creating a little, what I call anxiety motel. And so before he, you know, he goes to bed, he can write down a couple of things he's worried about and put them in the motel. And the motel would be safe. You know, you can put his stuffies around it and his worries will be safe. They'll be protected. And then in the morning, you can open up the box and see which of those worries you'd like to either talk about, work on, or carry around for the day. And it sounds kind of like silly. Another trick is like, okay, you're really worried about this thing. Let's worry about that for 5 minutes straight. Let's just worry about it. Ask those questions. You know, what would happen if? So one of the things that helps with anxiety is what would, and then what? So this terrible worry that I have, I say, okay, and then what? Can you live with that? And then what? Can you live with that? And we go sort of to the end of the line of the worry, and two things happen. Either the person says, I'm dead, so it doesn't matter anyway, or laughter, right? Because we start to see sort of the absurdity of it. Now, when you're going to a new school, it's normal to be nervous. Do you have a friend in your class? Do you have someone that you can meet before school starts that you could hang out with? So when you go walk into school or go into the lunchroom or go to the playground, you know one person or maybe two people. Okay, so I think those things would all be helpful. Seth?
Sharon, those are awesome, by the way. Those
Thank
are,
you.
yeah, those are fantastic. You rock. Yeah.
Anxiety's been my best friend for a long time.
Yeah. I mean, just there's so much, I don't even know where to start. But to piggyback on one thing, when you're asking I call it the why. So, you know, the tell me more, cool. Tell me more. Then what would happen? Then what would happen?
Right.
And to what you said, like 5 minutes, just go to worst case scenario, like, and compartmentalize it. That is something that is really powerful, a really powerful tool they can use on their own forever, that I use. But that questioning, and like, because what happens is when we don't do that, what we're doing is we're taking that initial thought and we have all those other fears behind it, but we're not seeing them. We're just seeing the surface one, the top of the iceberg one, and we're having the physical. So we're having the mindset of that. When I was talking about the mind and the body, like we're having the mind or story or narrative about that, and then the physical reaction, and we're not tracking back to question the story. So that's the narrative. Like, let's look at the story and get it in right sized. So that's really powerful. And also what you said about that, like, so sort of another technique related is like taking it and making it bigger. Oh my gosh, let's imagine all these things in the worst, you know, and making it so big. And then the other thing is, so those are all the what ifs. And this is one of the things I learned with my anxiety, however many years ago, but is what if this bad thing happens? What if? Fear is always what if this bad thing happens?
Mm-hmm.
Then going the other direction. What if this good thing happens? What is the opposite of these things? What if this happened? What if what's the worst thing that could happen? What's the best thing that could happen? What are the other what ifs? So that's really powerful as well. But what Sharon said all about like the pre-work of going into school, meeting teachers or meeting friends, touring it, seeing the locker, like those things can be so helpful. But the other thing is the tools around when talking through what are the fears, what might happen, and what can you do in those moments. So to me, it's very important to give kids and adults, but to give kids an out. Like they need to know they have an out. Like,
Yeah.
now some kids can say, oh, my out is I can go home and do school refusal. And I'm not saying just say, call me and I'll pick you up anytime. But you can say, look, if things get too bad, I will pick you up. You can always do this. We have this person at school who's on your side. Who are the allies? Is there a counselor you can connect with before the school year starts, or an administrator, or somebody that they can say, if you ever get super uncomfortable, just come to me, just grab a hall pass. Or so thinking through those things and talking it through and having a plan, just them knowing they have a plan for those things where they feel trapped and suffocated, just knowing they have an out often is enough.
I couldn't agree more, Seth. Having a plan is really important. And I wrote in the notes, when you ask you what could go wrong, that's easy because that's what anxiety is about. What if, what if? And I know that, in the last several years, I've started to ask myself, what could go right? What cool thing could happen that would be unexpected and could go right? I think it is important that you create a safety plan within the school rather than you being the safety plan, because we want to teach kids who are anxious resilience. We want them to learn how to depend on themselves. And if you are the safety plan, then you're the safety plan for a very long time. Right? So it is important to have you know that you're the safety plan. The person at school who is the safety plan there knows that you're the backup safety plan, but your child doesn't have to know, like, if I'm upset, will you come get me? Let's figure out what you can do in those moments instead. When I say, that my anxiety has been around for my whole life, anxiety is a protector, right? It comes up because it wants to protect you from something that you feel like could harm you or danger you. For me, it's been very helpful, and for many of my clients, to see anxiety as a red flag that's flying up the pole to say, whoa, I'm a little overwhelmed. I don't know what to do in this situation. It's novel. Let's, as Seth said, make a plan. That making a plan is really important, keeping it simple, writing it down somewhere, putting it in the phone, if they're allowed to have their phone, whatever.
And then the last thing I want to mention on that is that there is also the aspect of the nervous system, the body, the mindfulness, the having tools to experience the discomfort safely, right? So let's say your kiddo is going to school that first day, getting on the bus or getting in the car, getting dropped off, going into school, going into that first classroom. Almost all the kids in the school are going to feel nervous, almost every kid. But the experience of saying, okay, what's that like in our body? What can we do with that? Where are you breathing? Are you chest breathing? Are you belly breathing? What, like the reflection that I talk about a lot. But noticing, let's say your kid is petting the dog, and you're like, oh, I notice you look so calm right now. I notice you're breathing in your belly. I notice your muscles look, and I noticed earlier when this was happening, you look tight, and like helping them to have tools to notice and work with the discomfort. Your kid's going to experience it first day, second day, they're going to experience, but do they have also in the moment the tools to experience it safely and be like, you know what? Yeah, I'm going to get nervous, and it's okay. I can handle this. The resilience, Sharon, but having the tools so definitely talking through as much as you can before school. Like, let's look at what tools you're already using. Your kid's already using a bunch of cool tools to regulate at certain times. Help them connect the dots that they can use to give them names, the tools names that you guys want to use, or use somebody else's models. Doesn't matter, but make them articulatable. That's a word nowadays. So that what was Brendan had the wall of awful. You mentioned something monster, a worry monster.
Oh, I talk about the worry monster. Yeah.
Yeah. So make your own words or whatever to describe these things, to describe the tools. And
absolutely name it, draw it, put your arm around your kid with your invisible, lightsaber and beat it back.
Let's do one more quick question, then I gotta run. So you can unmute yourself or you can put it in the chat. And hi, Sharon.
Hi, I'm so glad you're okay. The news coming out of Maui is so terrible.
Yeah, it's been a rough couple days.
Let's take a minute and give thanks that Seth is okay.
Yeah. We were evacuated the other night. So this is the busiest week of my year. Now I already am busy 24/7. Like I've been working for months, and then this week is because, and then so we were evacuated in the middle of the night. Someone's banging on my door, and I'm like, what is going on? Like I was half asleep. I didn't understand. And then my friend David's like, we're being evacuated. I'm like, what? But we had seen the fire like earlier that night from the roof. You could see it. And then it was just like, I had to grab stuff and throw it in the car and go find somewhere to sleep and blah, blah. But yeah, I'm finding my place is fine. And but people, and if you all have time and energy and resources to help, we already have a housing crisis. People are unhoused. People are living in gymnasiums on cots right now. And there's a lot of rebuilding. So if anybody has ways to help, it is, yeah, tough time here right now.
Thank you for sharing that, Seth. And you have, I know, at least I'm gonna take a leap and say you have all of our wishes for safety.
Thanks.
and
I
health.
have so much outpouring from so many people in the community here and friends. I mean, in the community, like this TIFOS community, my followers and stuff, like my speakers, like everybody is just amazing. People are good.
Mm. So let's take one more question. Does anyone have one more question before we stop? Yes.
Thank
Hold
you.
on. Anna Maria, yeah.
So I wanted to, since we're here, wanted to take the opportunity, along with the, I haven't had my daughter diagnosed. I could, while we've been here, listening to all the great questions and everything, I was thinking how both my husband and I are like, don't love the idea of like having to get medicated. And I think that that's part of the reason why we've never like tried to have her diagnosed with actually even like anxiety and, other issues, because at the school that she was prior to the one she's at, we felt that any kid that was like, diagnosed with things like ADHD, they would, the school would be very like prone to say, yes, definitely medicate the kid. It's going to be great. And, and it's, I don't know. I mean, I don't know. Maybe I don't need to be scared of like medications and things like that. But I like, worry like that if I go down that path, that's going to lead us to having to, for her to take something like the rest of her life. And I don't know, like it just, I can see that we have like resistance, like when it comes to,
Right.
that kind of thing.
So,
Yeah.
so the thing is, an evaluation is a map. It's not a destination, right? It's an information booklet about how your child's brain works. What you choose to do with that information is up to you. There are plenty of people in the world whose kids have ADHD and who choose not to medicate them and really work on building executive functioning skills and sort of metacognitive self-awareness. And that's fine too. Medication is a tricky and very personal issue. ADHD is a biologically based disorder, and some people are able to find medication that really helps the dopamine and the norepinephrine pathways right away. And a lot of people don't. They can't find the right thing, and they get tired of trying, and so they stop trying. And what they do is they set up their life so there's alerts and alarms and reminders, and that's all fine. We want you to use the tools and your daughter to develop the tools that help her. There's no saying because you have ADHD, you have to medicate. I also think that as a person of color, the pressure on you to medicate your kid could be greater than it is for a Caucasian person, because of all the sort of racist biases around kids of color and the assumptions that are made about them, and perhaps the pressure that they may feel to conform in a particular way. So it's up to you. Just take the information and use it. The thing that's important when you get an evaluation or written evaluation is that sometimes parents feel super discouraged afterwards. Sometimes parents are relieved, like, oh, this explains it. But sometimes parents are like, oh my God, this is the most depressing thing I have ever read in my entire life. And what I want to say to you is, I hear that. I get that, and I hear it. And that the evaluation will identify strengths, and it will also probably spend a little more time identifying challenges, because that's part of how it works. You can choose whatever you want to pay the most attention to, but I just want to sort of give you a little bit of forewarning about that.
Thank you again so much.
Awesome.
welcome.
Thank you so much, Sharon. My thoughts on that is that many years ago, I was really anti-med. I really thought pretty negatively about them. But then as I was a teacher for 12 years, I would just see some kids be medicated. A lot of times they'll tell the teacher, we're trying such and such with this kid. They're diagnosed with something. And sometimes a kid would be like a zombie or like not themselves. And sometimes it was a game changer and a life changer, like a life changer. So for any medication, for any food you eat, for any activity you do, there's the cost benefit ratio. Like there's a good thing about it and a bad thing about it. And my thoughts to you would be, don't just shut it down. Like, no, meds are bad. Like is this more helpful or more harmful? But I'm telling you, I've seen some kids where it's just life-changing. And sometimes it's life-changing literally the day they start. And I'm not pro-med or anti-med. It's just that when there's the right med for the right person for the right thing, and it's game-changing and quality of life saving and helping, then don't just say, oh, this is a med, because there's so much distrust with the government. There's so much distrust with pharma. There's so much distrust with the media. And there's good reasons for the distrust, and everybody's confused about everything. But what we want, and what I want to teach kids, is how to think, and how to think using evidence, and how to not be ruled and run by cognitive biases, by black and white thinking, by fallacies. So these are, you could look at the world of philosophy and logic. You could look at the world of psychology to like look at different ways of saying how the mind is not always honest with ourselves. And I want kids to learn to honor their thoughts, but think them, to honor their feelings, process their feelings, and feel them, but not be ruled by their thoughts and their feelings, and to have tools to navigate their thoughts and feelings to get to the evidence and the truth, not evidence that they find because of biases and because of looking for answers that support what we already believe, but looking for evidence. So whatever, I just hope that you guys can feel like, okay, well, let's just look at the evidence and have an open mind to everything. Again, I would go back to the sleep, nutrition, and exercise that I mentioned before, and looking at those things, because those all impact executive function completely, as do other things. What Sharon said about skill building. So there's this term, pills don't teach skills. Pills do not teach skills, but pills can get the brain so that it can practice and develop skills. They can be a game changer there. So if somebody's also teaching skills with or without, but for some kids, what it does is it allows their brain to finally like be able to build the skills. And it can be a game changer in that way as well. So it doesn't take the place of building skills though, and being taught them. The last thing I had in my notes was, ultimately, whatever your choice is my thing is focusing on a few things. One is building strengths. So the system tends to be very weakness focused. What are your kids' strengths? Build on those in the next couple of years. How? Enrichment model from gifted education type of thoughts, but build on your kids' strengths. Give them experiences regardless of what's going on in school. That's going to build their strengths, their interests, their passions, their talents, their hobbies, the things that matter to them. That's number one. Number two, relationship. You and your spouse, yourself, your relationship with yourself, building your own relationships, looking at attachment theory and how to be more secure. The more secure you are in yourself and everything with what's called secure attachment, the more you're conveying that to your child. And then last one is nervous system, learning how to regulate emotion, learning how to sense the nervous system, know what's going on in the body, articulate it, the stuff we were talking about before. But those things, to me, the building strengths, the relationship, and the nervous system, are going to also, in terms of whether or not your child is medicated, those are things that I think are very big in terms of supporting your kid to be able to create the life they want.
Thank you so much.
You're very welcome.
Nicely said, Seth. Beautiful. I'm constantly talking about pills not being that pills don't teach skills.
Yeah.
Yeah.
I'm gonna stop this Facebook Live here.
Bye, everybody.
And I'm